Hello, my name is Chance Bolter and welcome to Lab 3 for Kinesiology/Biomechanics. Today I'm with Morgan and we're going to be demonstrating some movements of the hip. The first movement of the hip I want to talk about is flexion. Flexion of the hip is when the hip is moved anteriorly to the body. 6 muscles primarily responsible for flexion at the hip are the iliacus, the psoas major, the pectinis, the rectus femoris, sartorius, and tensor fasciae latae. To demonstrate hip flexion, Morgan is going to rotate and model a standing hip flexion. The next movement of the hip I want to talk about is extension. Extension of the hip is when the hip is moved posteriorly to the body. The hip extensors are the gluteus maximus and the 3 hamstrings, the biceps femoris, the semitendinosus, and the semimembranosus. To demonstrate hip extension, Morgan is going to rotate and model a standing hip extension. The next movement of the hip I want to talk about is abduction. When the lower extremities are moved laterally, the hip is abducted. The gluteus medius is the major abductor acting at the hip, with the gluteus minimus assisting. To demonstrate hip abduction, Morgan is going to sweep her leg laterally while the hip is abducting, going away from the midline. The next movement of the hip I want to talk about is adduction. When the lower extremities are moved back towards the midline, the hip is adducting. The hip adductors are the muscles that cross the joint medially and include the adductor longus, the adductor brevis, adductor magnus, and the gracilis. To demonstrate hip adduction, Morgan is going to start in an abducted position away from the midline, and she's going to bring the leg towards the midline while the hip is adducting, bringing it back towards the midline. The next movement of the hip I want to talk about is external rotation. Hip external rotation is when the leg rotates outwards, away from the rest of your body. This can be confused with abduction, however, this is one of the primary rotational movements of the hip. To demonstrate external rotation, Morgan is going to dorsiflex her foot and externally rotate her foot using her hip. The last movement of the hip I want to talk about is internal rotation. Hip internal rotation is the twisting movement of your thigh inward towards your hip joint. This can be confused with abduction, however, this is a rotational movement instead of a sweeping movement, bringing the leg back to the midline. To demonstrate internal rotation, Morgan is going to dorsiflex her foot again and internally rotate it using her hip. The last thing I want to talk about is the structure of the knee. The structure of the knee permits the bearing of tremendous loads as well as the mobility required for locomotor activities. The knee is a large synovial joint including 3 articulations within the joint capsule. The weight-bearing joints are the 2 condylar articulations of the tibiofemoral joint, with the 3rd articulation being the patellofemoral joint. Although not a part of the knees, the proximo-tibiofibular joint has soft tissue connections that also slightly influence knee motion. Major ligaments of the knee include the PCL, MCL, ACL, LCL, and menisci. Thank you for tuning in to Lab Video 3 for Kinesiology/Biomechanics. Thank you.